But let's start this Friday talking about health, specifically men's health. And June is a month to bring awareness of preventable health issues men could face. So helping us get ahead today is Dr. Michael Kemper from Georgia Urology. Hi, doctor.
Hi, thanks for having me.
Well, thanks for being here. I think this is so important to talk about, and I'm glad that you're here to discuss it with us. Let's talk about benign prostatic hyperplasia, or BPH. What is it and what causes it?
So BPH, benign prostatic hyperplasia, is the growth of the prostate as men get older. It happens to all men, so about 50% of men over age 50, 70% of men over age 70. It's not cancer. It doesn't turn into cancer. It's just as all men get older, the prostate gets bigger.
Okay, how is BPH treated then?
So people typically will have symptoms of urgency, frequency, needing to run to the bathroom all the time, and that can be treated either medically with certain medicines like tamsulosin. It can be treated with minimally invasive procedures or with surgical procedures.
Okay, let's talk about Greenlight laser therapy. What is that? And is that a treatment to BPH?
It is. So
Okay.
Greenlight laser therapy is a treatment using a laser to shave out a portion of the prostate from the inside.
Okay.
That maintains a channel to allow people to pee a little bit more freely and empty the bladder better. It's typically an outpatient procedure. Come in, we do the procedure, you go home later the same day.
Nice. I think a lot of times too, we think, it's an inconvenience, but then when you know that there is a solution, it can really be life-changing. So why is Greenlight an important option for men with BPH?
So this is something that a lot of guys will just live with. So that run into the bathroom, that getting up 3 times at night to go to the bathroom, and it's something that we have solutions for, and that sometimes medicines don't work, and a lot of people will stay on them for a little longer. And Greenlight can really help with improving that quality of life, helping you empty your bladder better, helping you in protecting long-term, not needing a catheter, not needing any long-term problems with your bladder health.
Sure, and you mentioned the procedure is quick, but how soon will patients then feel relief after this procedure?
So typically people will have a better force of stream immediately after the procedure. There are some irritative symptoms, that urgency, that frequency, some burning that gets better, and then within a week or two people are typically doing a lot better.
Okay, how often, or how long I should say, do patients need to stay then in the hospital after getting a Greenlight?
This is an outpatient procedure, so people come in, we do it, takes about 45 minutes, you go home later the same day. Most people will have a catheter in just overnight, comes out the next day.
All right, we can't beat that, doctor. Okay, will men be able to stop their BPH medications then? You mentioned sometimes it can be treatable with medications after they have the Greenlight BP procedure.
Goal is to get you off your meds.
Okay, all right, well that's good because the less meds we take, the better, especially as life progresses. Okay, so after this procedure then, can you go right back to work?
I typically tell people to take a couple of weeks off from work, just take it easy. I don't expect anyone to be flat on their back. Everything is done through the urethra, so there's no big cuts on the belly or anything like that.
Okay.
But a little bit of urgency, a little frequency that gets better. Within a few days to a week or so, people are typically back at work.
All right, men are more sensitive too, so we'll give y'all a week. All right, okay, doctor, tell everyone where they can find you and how they can book an appointment with your practice.
Certainly. I see patients in Decatur and in Conyers with Georgia Urology. You can go on our website, georgiaurology.com. We have a self-scheduling, or you can call our number and we'll get you right in.
All right, I love that you were here today, and I think we educated a lot of people about the options out there. Thank you, Dr. Kemper, for being here.
Thank you so much for having me.
All right, we appreciate you. Okay, to learn more about Greenlight laser therapy, you can visit treatmybph.com, or to book an appointment with Dr. Kemper or Georgia Urology, visit georgiaurology.com. You can call that number right there on your screen, 404-292-3727. And thank you to Boston Scientific and Georgia Urology for sponsoring that segment. All right, well, we're going to switch gears just